The investors in that new company include some really impressive investors like Spectrum Ventures out of Michigan and a bunch of others. We've got a network of about 20 large organizations who are in that network, basically customers of Professional Credentials Exchange. And we've got a fantastic new business model the world's never seen before in terms of solving, this really hair-on-fire problem in healthcare that has everything to do with revenue cycle and access to care for patients and patient safety.
This is Fabiola Florenville, CEO of Blueprint Creative Group. We provide strategic communications counsel during times of opportunity, change, and crisis. And you are tuning into the Nashville CEO podcast. And today I have the pleasure of speaking with John Bass, who is the founder and CEO of Hashed Health. How are you, John?
Hey, I'm great. Thank you for having me on your podcast.
Yeah, it's a pleasure having you. So Hashed is a healthcare innovation studio. What exactly does that mean in layman's terms?
Yeah, so I think it's the coolest job in the world, and that is to build innovative new companies in the healthcare technology space. So we help large enterprises innovate in ways that they can't kind of do on their own for a variety of reasons. And we at Hash focus on a specific type of innovation using blockchain and distributed ledger technologies, which are really technologies. It's a family of technologies that are designed to solve shared problems that exist across healthcare enterprises.
Right. So you're coming into these, large enterprises, or are you working with startups? What size enterprises?
Yeah, generally they're big companies. Like most of our clients are large pharmaceutical companies, insurance companies, health systems, and other technology vendors that we partner with.
Okay, so are you coming in and helping them develop their blockchain technology?
Yeah, blockchain is all about networks.
Yeah.
So it's all about using kind of the software that allows you to build systems where trust and transparency are critical to solving a shared problem. Things like payment challenges or identity challenges or challenges that exist across a supply chain or any type of value chain. And we help not only develop technology, but we also help bring together kind of these networks that suffer from a shared problem. And we build out kind of shared solutions and jointly operated infrastructure that help them all solve that problem as a community. So these are almost like, you can think of them almost like utilities.
Right. So where do you see the future of Nashville when it comes to developing a larger ecosystem of healthcare innovation, and particularly in the blockchain sector?
Yeah, Nashville's got an important role to play just because we're such a focal point. There's a center of gravity, a lot of concentration here for healthcare, especially provider-side healthcare talent and provider-side healthcare businesses and provider-side healthcare ideas. And, with COVID and everything else that's going on, there's so much change and so many kind of demands on the industry right now that, Nashville has a really important role to play in standing up new types of solutions that are meeting the U.S. healthcare system where it is and guiding where it needs to go next.
Okay. And so what do you think could even accelerate the local ecosystem even larger so that it can be at the forefront nationally and even internationally?
Yeah, I think we're seeing trends that, the Nashville healthcare community is well aware of, trends around the need for greater interoperability, greater collaboration, and greater kind of focus on the consumer experience, and generally a shift from kind of traditional volume-focused healthcare delivery models and pricing models to more value-focused delivery models and benefit structures and pricing models. And so, really kind of we've known about these trends for quite some time. And I think that the challenges that we're facing right now are just putting greater emphasis around the need for the healthcare community to really put their foot on the gas in terms of innovation and enabling and realizing these new innovative delivery and payment models.
And you're essentially the go-to guy when it comes to blockchain technology, right? You speak all over about it. You've had some recognitions around it. I believe you were named Innovator of the Year, or the company was named Innovator of the Year. So you're the go-to, particularly blockchain and healthcare.
Yeah, we were the first to market in the space back in 2016.
Wow.
And, back then it was kind of like standing in an empty room. And so we immediately knew that we needed to really educate people on the technology and start building, developing the market and developing a community of businesses and thought leaders who kind of care about what this technology enables. And all of that early market development work, all of the early experimentation that we helped our customers execute on, all of that has matured over the last several years. Now what we've got is a big market with a lot of really interesting use cases. Almost every insurance company in the U.S. is now involved. Every pharma company in the U.S. and Europe are involved, and a lot of health systems are getting involved. And there's no question about whether or not it is a real technology and if it's going to stick around. It's more what use cases are appropriate at this point in time and how are they going to start affecting the traditional value chains in healthcare. And so we've been fortunate to kind of have a front row seat to all the maturation, both on the technical side and on the kind of the business model innovation and also the networks that are coming together around the technology. We've kind of been had a seat at the table for all of that. And along the way, we have won a number of awards, and we've done a lot of kind of speaking, and we've got a roster, a network already of brand name large companies who are working with us to bring forward a lot of these solutions. So it's been a really interesting and fun 4.5 years, and we're busier than we've ever been, which is exciting for me because it tells me that the work we're doing at this moment in time is really important.
Yeah, so the room is no longer empty anymore, right? You have believers now.
Fortunately, it's not. Fortunately, it's very crowded now.
Good.
But it's absolutely an incredible and innovative space, and there's a lot of good that's going to come out of the work that we're doing. So it's something that we're excited to do every day.
Okay, so what does the future look like for Hashed Health?
Yeah, so we've matured and kind of unfolded a strategy over time that I really am excited to see being realized. And so we started with, as I mentioned, a lot of market development, community building, and then that led to a lot of advisory and consulting and services work with these big companies. And then that led to kind of building kind of experiments, early products, and then some of those early experiments have matured now into real solutions. And as we've built those products, we've become a vehicle for enterprises and ideas to move products to commercialization. And so as we've matured through that process, we've begun launching new companies. And so we launched our first spinoff late last year. It's a company called Professional Credentials Exchange that solves a physician identity and credentialing problem in a brand new way. And that new company was, we launched the company. The investors in that new company include some really impressive investors like Spectrum Ventures out of Michigan and a bunch of others. We've got a network of about 20 large organizations who are in that network, basically customers of Professional Credentials Exchange. And we've got a fantastic new business model the world's never seen before in terms of solving, this really hair-on-fire problem in healthcare that has everything to do with revenue cycle and access to care for patients and patient safety. And so it's a great example of how you can use this technology to solve old problems in a new way. And we have a queue of other projects that are now moving through that same process of validation and go to market. And both technical and network development activities. And so we're tracking a queue of about 10 different things that we hope will follow in the footsteps of Professional Credentials Exchange and be launched over the next several years.
Okay, well, that's exciting. So you're at the forefront of where healthcare is moving, and you're probably seeing a lot of what we are yet to discover about healthcare innovation, particularly as immunology and technology now tend to blend, in light of COVID and the race for a vaccine.
Yeah, it's an exciting space. I think COVID, the country is really struggling here. And I've personally had family members who've been affected by COVID, and fortunately they've all recovered and been fine. But that struggle is also an opportunity to learn and an opportunity to change behaviors and an opportunity to understand and build better, more equitable systems of care delivery and payment and insurance models. And so it's really kind of laid bare a lot of the issues that healthcare has around trust and transparency and the alignment of incentives and generally our ability to collaborate. It's really exposed a lot of the traditional weaknesses in those areas. And so the technology we focus on is really geared very specifically at solving a lot of those trust and transparency and alignment issues. And whether it's in supply chain or in the claims life cycle or insurance or identity and medical records, there's just lots of different opportunities to accelerate and catalyze innovation using collaborative technology. And we feel that our business model is kind of the business model for collaboration. And we feel very confident in our approach, and we feel like despite the challenges our country faces around COVID, we're also at the same time very excited to help the country move forward and build infrastructure that is more fair and equitable and respects the privacy of the patient. So anyway, I think we're going to look back at 2020 as a moment in time where we enable a lot of innovation, and my hope is that Nashville continues to be a center for how care is delivered to consumers and patients over the next decade.
Well, that's the light at the end of the tunnel when we're in tough situations entrepreneurially. We start to solve problems and issues that, would not have been discovered until the layers were peeled back. So I definitely believe that moments like this gives us a new sense of energy, and it's a rebirth for ingenuity, and that anything that needs to be created or developed to solve our current issue and challenge, we have the talent right now to do so. So it could only go uphill from here.
Yeah, and I think one of the things that's just critical at this moment in time is that we recognize the opportunity to build these systems in a way that respects the things that we really haven't been good at respecting in the past. And what I'm thinking of specifically is privacy preservation, the self-sovereign nature of this information, meaning your medical record is the patient's information, right? Yeah. And the door to that information should be opened and closed by the consumer or by the patient moving through their life. And it should be respectful of things like social determinants and social needs. And it's not just about healthcare, and it's not just about the clinical setting. It's about the full kind of robust and self-sovereign identity of that patient.
Yeah.
And so building systems that respect healthy communities and equitable access and the patient-centered nature of healthcare delivery in the future, I think this is a critical moment in time for those types of initiatives, and I'm proud that that's what we represent to the healthcare community.
Well, good. It's been a pleasure talking to you. Can you share with us how people can learn more about Hashed and where to follow you?
Yeah, absolutely. Online we're at hashedhealth.com. We do a lot of writing on our blogs and newsletters, and we do a lot of speaking at events. Written a book called Blockchain in Healthcare that I co-authored, and there will be additional writings coming around the innovative work we're doing in 2020. I'm on Twitter at John G. Bass or at #HashedHealth on LinkedIn and things like that too. So It's all about getting a community involved, and one of our core values is radical collaboration. In order to do the work that we are trying to do, we have to be super collaborative. And so that's our whole world is how do we work with people to innovate this way. And so I'm happy to hear from anyone who has ideas on how we can work together.
Well, good. So it's been a pleasure. Thank you again.
Yeah, thank you. I appreciate you having me on.
Thanks again for tuning in to the Nashville CEO podcast presented by Blueprint Creative Group. There are 17 other episodes featuring Nashville CEOs, and we thank all of the participating CEOs for sharing their voice. Check out all of the episodes in this series at blueprintcreativegroup.com/Nashville.